Hello and welcome everyone. My name is Joy Schwartz and I am a Community Support Specialist at DECA. The implementation stage is putting your plans to work. This phase isn't easy, but it will be a lot easier if you've done a good job planning and have the support of the community. Paying attention at the beginning of and throughout the implementation phase to some specific aspects of it will also make the task easier. Before implementation, your coalition should have conducted a needs assessment, developed a logic model, an action plan, and an evaluation plan. Strategies should have already been selected to address the identified problems in your community, and now your coalition is ready for implementation. By doing all the important work to prepare for implementation, you've become an expert in your community's specific problems and conditions, and you've worked through a process to define strategies and actions that will have a real impact on those conditions. Now you're ready to put your plans into action. During implementation, the coalition begins to see the fruits of their labor as thoughtful and effective evidence-based strategies are put into place. As you are beginning the implementation step, it is important that all activities implemented should be aligned with the strategic plan and support the goals of the coalition. Implementation takes planning and preparation, including these three broad tasks: enhancing support and building capacity related to implementation, implementing evidence-based programs, policies, and practices while paying specific attention to issues of adaptation and fidelity, and monitoring implementation by collecting evaluation data and making mid-course corrections based on what the data reveals. Mobilizing and building capacity to support implementation involves the following: increasing community awareness of the problem and of the strategies selected to address it. This will help improve the readiness of the community to adopt the strategy and carry it out successfully. Before implementing any strategy, it is essential to figure out how to best increase awareness of the problem among stakeholders, community leaders, and the community. Introducing the intervention to stakeholders to obtain their buy-in and expand partnership. Getting stakeholders, partners, and community members on board and ready to implement a strategy can take time, particularly when there is turnover or if there is resistance. Training may be necessary for the people implementing the intervention if they do not have the necessary skills. Training can also help overcome hesitation, resistance, by alleviating misperceptions and clarifying expectations. Provider training and support. Pre- and in-service trainings can help providers who are responsible for implementing a program to understand how and why it works, practice new skills, and receive constructive feedback. Since most skills are learned on the job, it is also very helpful to connect these providers with a coach who can provide ongoing support. The implementation of evidence-based programs and practices requires behavior change at the provider, supervisory, and administrative support levels. Training and coaching are the principal ways in which behavior change is brought about for selected staff in the beginning stages and throughout the process of implementing evidence-based programs and practices. When a strategy is implemented as its developers intended, there is a greater likelihood that its impact will be similar to the settings where it was first implemented or tested. Maintaining fidelity means keeping most elements of the program the same. Maintaining fidelity ensures best practice and likelihood of desired outcomes. According to SAMHSA, it is crucial to balance fidelity with adaptation. However, programs may need to be adapted in order to gain greater community acceptance or in response to the context of a particular setting. Budget constraints, staff availability, time limitations, or other issues may make adaptation necessary. So even so, implementing a program that may require some adaptation may be more efficient and cost-effective than designing a program from scratch. Fidelity is the degree to which a program or practice is implemented as intended. Adaptation is describing how much and in which ways a program or practice is changed to meet local circumstances. Evidence programs and practices are defined as such because they consistently achieve positive outcomes. The greater the fidelity to the original program design, the more likely the program will be to reproduce positive results. While customizing a program to better reflect the attitudes, beliefs, experiences, and values of a focused population can increase its cultural relevance, it is important to keep in mind that such adaptation may compromise program effectiveness. Remaining faithful to the original design of an evidence-based program or practice while addressing the unique needs and characteristics of target audience requires balancing fidelity and adaptation. When we change a program, we risk compromising outcomes. However, implementing a program that requires some adaptation may be more efficient and cost-effective than designing a program from scratch. Retain core components. Evidence-based programs are more likely to be effective when their core components are maintained. Core components are those parts of a program or practice that are responsible for producing positive outcomes, and thus most essential and indispensable. Core components are like the key ingredients in a cookie recipe. We might be able to take out the chocolate chips, but if we take out the flour, a core component, the recipe won't work. However, in understanding and adhering to the principles underlying each core component may allow for flexibility. Build capacity before changing the program. Rather than change a program to fit local conditions, consider ways to develop resources or to build local readiness so that it can be delivered as it was originally designed. Add rather than subtract. Doing so decreases the likelihood of important program elements. Adapt with care. Even when programs and practices are selected with great care, there may be ways to improve their appropriateness for a unique focused population. Cultural adaptation, for example, refers to modifications that are tailored to the beliefs and practices of a particular group and enhance the cultural relevance of an intervention. To make a program or practice more culturally appropriate, consider the language, values, attitudes, beliefs, and experience of focus population members. And if adapting, please get help. Knowledge experts such as program developers can provide information on how a program has been adapted in the past, how well they've worked, and what core components should be retained to maintain effectiveness. Members of the focus population can also suggest ways to enhance program materials or messaging to better reflect their concern and experience. Keep in mind that adaptations can be planned in order to improve a program. Like the case with cultural adaptation or unplanned, it's important to be aware of the potential for unplanned changes that may occur during implementation, such as mixed sessions, when schools close unexpectedly due to bad weather, or to address any changes that might compromise program effectiveness, like a schedule makeup session so students don't miss out on core program content. Strategies and action steps need to be aligned with identified risk factors, be actionable, are environmental or individual, are evidence-based, are culturally appropriate, and are effective as well as sustainable. Ensuring strategies are effectively implemented require these 5 steps. Create an action plan that includes tasks and a timeline for implementing interventions. Mobilize support and building capacity. Carry out your chosen evidence-based strategy in a timely and effective manner. Monitor, evaluate, and adjust as necessary, and conduct desired outcome evaluation measures. During the first 3 stages of the Strategic Prevention Framework, or SPF, your coalition conducted a needs assessment, built capacity, and developed a logic model and action plan. This will be your guide. Before implementation, make sure the best strategies and action steps to address the problems in the community have been chosen. A clear action plan, when developed in collaboration with all key partners, can help to ensure that everyone involved in implementation is on the same page and no key tasks fall through the cracks. A clear action plan includes all implementation tasks, deadlines, and persons or responsible. Implementation monitoring. By closely monitoring and evaluating the delivery of a program or practice, planners can make sure that it is being implemented as intended and can thereby improve it as needed. By assessing program outcomes, planners can determine whether a program or practice is working as intended and is worthy of sustaining over time. Assessments of provider performance and measures of fidelity also provide useful feedback to managers and implementers regarding the progress of implementation efforts and the usefulness of training and coaching. These implementation supports are interactive and can compensate for one another, so that a weakness in one can overcome by strengths in others. Organizations are dynamic, and there is an ebb and flow to the relative contribution of each support to overall outcomes. Implementation monitoring can help to reveal where supports may need to be adjusted to improve effectiveness or efficiency. Your coalition identified what needed to be changed during the planning phase of the Strategic Prevention Framework. In the implementation phase, plans are put into practice and efforts are monitored by coalition members and community partners. During implementation, coalition members acknowledge commitments made to carry out and/or oversee various aspects of the coalition's work. Many things can influence how a program is implemented, including staff selection, staff training, staff and program evaluation, available resources, and experience with implementing prevention programs. Leadership and relevant data helps keep volunteers organized and focused. Also, the history of strategies is useful to determine successes that you can build on. For successful implementation of the strategies that have been selected, coalition members and community partners will need to become advocates for change and gain the support of multiple sectors of the community. To make environmental changes in your community, you will need information on current policies, practices, and laws. Learning all you can about your selected strategies enables you to support your statements with facts, which gives you credibility. Part of every stage of the strategic prevention framework process are the concepts of cultural competence and sustainability. These two concepts should permeate each stage and help guide you in all areas of the process. Sustainability and cultural competence are a component of every phase of the SPF. Ask yourself if your chosen evidence-based strategy will have long-term impact that is sustainable over time, and whether the intervention fits the culture of the target population. Every change effort, whether for individuals, organizations, or whole systems, such as communities, acts as a lever. Just as a longer lever makes it easier to move heavy objects, long lever strategies should be incorporated by the coalition in order to create longer-lasting change. A culturally competent professional understands that people may choose to participate in different ways and that they may also have a different learning styles when it comes to understanding the strategy. Build on community members' strengths and draw upon their diverse perspectives and experiences. Encourage community involvement in the implementation of the strategic plan. In summary, implementation involves three main tasks. Mobilize your support for your efforts, build capacity around implementation, implement evidence-based programs, policies, practices, paying attention specific to adaptation and fidelity issues, and monitor implementation, collect evaluation data, and make mid-course corrections based on results. Additional resources to enhance your prevention work can be found on the Kansas Prevention Collaborative website. Here are a few links to resources that can help your coalition plan for sustainability. Thank you for viewing this webinar, and best of luck in your sustainability efforts. Thank you for your time, and if you have any questions, please contact your DECA Community Support Specialist who can provide technical assistance or training.